Making a difference in healthcare requires collaboration between researchers, startup founders, and policymakers. This is what Delta is about, hosting conversations with leaders on the path to serious innovation. Hello everyone, my name is Roupen, and I'm a physician on a journey to meet people who are making a delta in healthcare. Hello everyone, and welcome back to a new episode. Today, I'm very lucky to have with me Huzaifa Sial. He's the visionary founder and the CEO of Helpcare AI. He has a rich career spanning working at big companies and giants like United Healthcare Group and Optum. Huzaifa combines deep expertise in AI, clinical informatics, and healthcare technology, which is mind-blowing. And that's why I'm very, very excited to have him here on the show today. His mission at Helpcare AI, which is a Y Combinator backed up company or a startup, their mission is to simplify care coordination, improve patient outcome using AI agents, which is crazy. I'm very interested to hear about. And these AI agents can call patients and it can increase organizational outreach. And it's a huge problem that I will touch base when I talk to you about more details. But first, Huzaifa, welcome to the show. Thank you so much.
Yeah, thank you. Thank you for having me. I'm excited to kind of have this discussion. This is an interesting space, and I'm curious to see where we all take this. Yeah.
I love it. Can you take a bit? Can you tell me first about your journey? Like, how did you end up founding the company, Healthcare AI, and what really motivated you to do this?
Yeah. So it's funny. Healthcare, we were just talking about this. Healthcare is not an easy industry, right?
Yeah,
And so I think I was when I was younger and studying, I decided I was not going to be a doctor. That was the that was the big thing. My parents were like, "You need to go to medicine." My brother is a doctor, and I was like, "That's definitely not what I'm doing." And
yeah,
so I went into the direction of computer and business and other things. But out of that, I ended up right out of that, I ended up joining a health tech startup, and then
interesting.
I did my bachelor's from Canada and I moved to the US in Southern California, and I was doing that startup for a while. And as I got more and more into healthcare from this like non-medicine, non-clinical side, the healthcare bug bit me, and I was like, you know what? I think this is exactly what I'm gonna do. So I've done a couple of startups, and like you mentioned, worked for, and outside of that, worked for United and Optum. Our startups exited before, so I've gone through some of that as well, starting something from scratch, going sort of exiting it out into a larger company, working for a large company at United Healthcare. I led a few teams for personalization, for um, care gap closures, for search, and some of their Gen AI stuff as well. And I think overall, what kind of my biggest motivation has been after spending sort of 14 or so years in healthcare AI specifically and building some really, really complicated products from disease prediction to like, behavioral modeling and all that other stuff to get people better care. I realized, honestly, it's not the science that is the bottleneck. There's just some wonderful, beautiful science out there, but it can't get to the people, and people can't
Hmm.
get to the services. And, forget some next generation, medications and drugs, which I think are very, very important. But there are people out there that have never had, like, haven't had their physical in a few years, haven't done some basic cholesterol testing, haven't done their mammograms, haven't done some of the very, very basic public health stuff. And time again, when we built these sophisticated tools, we realized that they were not reaching enough people. And so I think that's really what motivated me to go, you know what? I want to do something in healthcare. I can't have my whole career and not have something to show for it, something that I think is meaningful and makes a big difference. And so I started healthcare. And the goal for healthcare is really, it's not the science. There's lots of smart people doing that. We just want to make this care coordination, this administrative stuff, the stuff that keeps all this thing away from people and people away from what they need. Let's solve that. And it's annoying enough that everybody's happy that we when we are trying to solve it. Nobody likes this, nor the patients, nor the staff, nor the clinicians. So I think that's a really good opportunity and probably what we need the most. Yeah.
Yeah, I love it. I think you touched on very important points. Like first, like the administrative costs for healthcare. The biggest expenditure in healthcare is administrative in the United
Yeah.
States, not in Canada. In the
Yeah.
United States, the biggest expense is administrative. And I can tell about from my personal experience, like you have to hire people to call patients, to book them, to follow up on them. And this is like an expense that you can utilize in something else. Like you can
Yeah.
improve your center if you can do those administrative tasks. Cheaper and faster and with more outreach.
Yeah, absolutely. And I
Yeah,
think the thing you mentioned in terms of cost and overall like the time that it takes, if you look at all the broader care gaps, only a third of the people in the US meet most of the care gaps. So as a public
hmm.
health, goals, only a third are hitting. Those are the quality metrics overall, roughly. And if they're like underserved population, maybe lower literacy, maybe English as a second language, or some other modifying factor, then that number is even lower. So what does that tell you? That tells you that even though healthcare is $1 trillion industry for the US, it needs to triple just to meet baseline of care.
Yeah.
And so your point about maybe they can do other things, there is so much to do. And that's the
Oh
hope.
yeah. And the other thing is you mentioned like people who are not meeting their healthcare needs, like basic things like lipid panel screening or other things. I think we do a horrible job when it comes to preventive medicine. It's
Yeah.
horrible. We do great job in treating cancer. We do great
Yeah.
job in creating medications because, like, let's be honest, that's where the money is. When you create a drug and you sell it and you patent it for 20 years and you make
Yeah.
tons of money, like there isn't not much money in prevention, but like this, the government, Medicare, Medicaid, these entities should be
Yeah.
really interested in prevention. Like we detect cancer in stage 4, despite that you can detect it in stage 1 if you do more better screening. Like
Yeah.
pay money more for it comes to prevention. And you mentioned the other things like outside of my specialty, like the lipid panel. Why would you take someone when they had a heart attack versus like treating their
Yeah.
high cholesterol when it's just like high cholesterol without symptoms?
Yeah.
Yeah.
No, absolutely. And it's like the thing I imagine is it's a bad example because human life is not equivalent to any car or something. But that's the thing we're used to. Yes, it's like taking your car to the mechanic every time it's broken, but you've never gotten an oil change, you've never gotten a tune-up, you've never gotten a filter replaced, your
Yeah.
tires have blown down, you've never gotten those replaced and changed them every season. And then you're like, wait, all of a sudden this is not working and that's exploded, my rims, my engine lights on. And then we have all these ways of treating these really acute problems, but really it's just millions of people walking around with check engine lights on, right? It's like a pretty easy way for us to think about. And just because it's not visible or understood, people feel like, hey, I think I'm okay, right? Nothing's hurting, there's no problem.
Exactly. Yeah.
I should be good. But this is what hopefully needs to change.
I love it. We can talk about this for hours, but like I want to switch gears now. And can you tell me a bit more about healthcare AI? What is the specific problem in healthcare that healthcare AI is solving?
Yeah. So, like we mentioned, I think the administrative burden of care
Hmm.
coordination is just exploded. There was a graph that I saw, I'll send you after, that it's almost the growth of the admin as opposed to the clinical has been like 500% or something. And so what's happened there is just the way, at least in the US, the system is set up. You have payers, you have plans in the middle, you have providers, and then you have the government CMS setting some rules. Then you have people with very individual different lives. You have different states with different availability of care. When you put all of that together, it just gets really, really complicated. You need approvals for things, but the specialists are not in this area. But then in this one, you need this other thing. And that fragmentation just leads to everyone like a traffic jam everywhere. And so that's what we're trying to do is we're trying to solve all of this administrative coordination burden. We think AI is the best way to handle this. And we're very excited because we're seeing some really phenomenal results.
I love it. Take me through, like, let's say I'm a healthcare executive, I'm in my office, I'm listening to this now, right now, or I'm a hospital CEO, and I want to use this healthcare AI or deploy these agents. Like, where or what department in my institution I can come to you and say, like, Huzaifa, please help me. Which department you can solve my problems in, where I can deploy your AI agents.
Yeah, so we are generally working with the COOs of sort of the orgs, the operations, maybe the QI team, I think. And oftentimes they're sort of setting up the workflows of the organization, and they're the ones that are dealing with a lot of this. And so that's those are the counterparts for us. And what's interesting about our AI agents is our AI agents are not tools that someone operates. They instead operate the tools. They're not necessarily live in the browser. They live in all the space in between the tools. And so the way to implement them, which is, and this is the whole new, world of agents that we're still understanding and forming. The way to implement them is to teach them all the steps that are need to happen in a workflow. Your standard operating procedure of like, this is how we book an appointment, here's the information we need to gather, or even clinical intake or patient intake, administrative intake, any of that type of stuff. So we gather all that information, we teach it to our AI agents. They're able to do text, calling, they're able to send emails, they're able to even they're able to have a voice, and they're able to use your tools, mouse and keyboard. So they
Oh,
actually
wow.
just follow the whole thing. They will look through the EMR, they will apply the guidelines and find, hey, this person needs to come in for an A1C, they have diabetes and therefore they need to come in every year or something like that, or someone else is due for a colonoscopy. They then actually go follow the best standard. We have a script, a best-in-class scripts from American Heart Association, Mayo Clinic has really good information on these things. So we have these basic FAQs in multiple languages too. So then these agents can actually make that call, talk to you about it, explain things, and then based on that, agree to get an appointment time. You can look in the EMR fine and then just go and do schedule the whole thing, enter all the information, update your address, update your insurance. It's amazing what's possible.
That's mind
And
blowing.
yeah. And so these are just in the cloud. They don't have physical form, but they're able to open all your tools and then just do the thing. And this is funny in the world that we're entering in. So our software, that's why I say we don't technically have users because they're autonomous. The whole point is they're working 24/7. You don't need to be in the middle. Yes, of course, if there's questions, they'll be like, hey, let me take you to a manager, and then they do direct calling, and let me take that message for you. And but for the most part, they're just operating entirely by themselves. And we have a portal where you can assign tasks and review tasks. But my hope is you don't even need to go there. Once a workflow or a duty is active, the result of that work is just showing up in your EMR, right? Just like any other staff, right? So you just look at your schedule. Oh, there's a new appointment. Great. Oh, here's the details of the appointment. Here's the chart updated. So you really don't have to hopefully come in, even go into our portals. That's how we implement this. And that's kind of a weird feeling, because people are like, wait, so if it's gonna do all this, like what am I supposed to do? And the funny thing, my answer to that is, I had to first think about this, and I was like, why are people having this reaction? And what I realized is over the last decades, 2 decades, 3 decades, software has only added work to a person,
Oh,
you
yeah.
know?
Oh, yeah, I agree.
It's only ever added it. And so it's always one more thing to do. And when you build tools that are now taking the work away, we just don't know how to understand this feeling. And like we were talking about, there's just so much to do. There's this, we have to triple everything in terms of who people want to care for. So that's what I tell them. I was like, you know what? Let me take some of this work. I guarantee you within an hour or so of free time, you will realize, oh, I have all these other things to do. Because healthcare is never ending and never stopping in that sense. But that's sort of how we get implemented. That's how the tool is, and those are the partners that we work with.
I love it. Take me through the patient experience. Let's say I'm a patient and the organization that I work with, they use one of their tools. What would I expect?
Yeah. So our patient-facing AI, we have two AIs. We have David, who does data science, and we have
Yeah.
Angelica, that is admin. Angelica is more patient-facing in the sense that Angelica makes the calls that the patient is talking to on the other side, and Angelica texts. Outside of that, hopefully, you don't even need to deal with her. The rest of her just operates in the EMRs, and that's the nurses and the staff, and they see the work. But you, as a patient, you're really just getting a call and texts. What we're trying to go for is when I was working, it's kind of this new world of relationship building with the patient, this concierge experience that the AI can do because the AI is available. And so right away at this point, there's no app they need to install. There is nothing separate additional they have to do. And honestly, this is what my biggest learning from being in healthcare for like 12, 14 years or something is like, you just don't add anything more, right? Nobody wants to do that. So they'll just receive a call from the doctor's office, right? From the practice, the health center, the plan. We're working with a few different partners. And they take the call and be like, hi, this is Angelica speaking. I'm calling on behalf of this. And it's a very organic conversation. They sometimes, most of them don't even know they are specifically talking to an AI. They just have the conversation and they can call that number back anytime. They can, if the call hangs up and they get a reminder text, they can text back saying, hey, actually change it from 3 to 4, and it understands everything. And so going forward, we're sort of building this patient experience where you will have your version of Angelica available for you at all times to have this conversation with. And starting out, she's just helping you book some of your basic appointments. And maybe if you ask her to do something else, she'll take a note. But over time, we really want to develop this relationship. We think this is important. Like I said, I worked at United Healthcare building personalization engines to help kind of United serves a very large population, 20 million or so in the US as an insurance through all their kind of insurances, and they were trying to show people all the benefits they can use, right? And or the care gaps that they had, like all the things that they really should be doing. And what we built all these like complex models to predict behavior and interest and see like if I show this person to this thing that they really need, their chances of getting that done are high. And so if I only get one chance on a page, I don't want to show them the 500 things they could be doing. I want to show them the two things that they likely will do and should be doing. And that's just a pixel and on a screen. And even that was very engaging. Angelica has a voice. She has a personality.
I
How
know
engaging is
for our listeners who
that?
are, so I went to your website. So for our listeners, you can go to Healthcare AI website and it's very hyper realistic. I'm very impressed. I'm a person who uses AI a lot and I'm very like used to talk to AI, but I think the two agents that you have on your website, very hyper realistic. Like if I was a patient, I received a phone call from one of them, like I would never think that this is a human versus an AI. Like it's that's good. Yeah.
And it's just the beginning, to be honest.
I know it's mind blowing.
Yeah.
I love it. And so, where are you guys right now? Like, what are the milestones that you achieved, and what are the next things that you want to go from there? Because these agents can do many things.
These agents can do everything, many things, to be honest. And I think part of that is part of the biggest thing about implementing this in healthcare is you just have to be thoughtful about what is worthwhile doing, what and where
Yeah,
you want to start. Because you want to start thoughtfully. You want to start in things that make a difference, that don't create more chaos, both for the staff as well as the patients, because they're both burnt out. They're both burnt out by like really bad tech implementation. So at least we're extraordinarily mindful of that. Where we are in our journey is, we've been exploring some of this new technology. We have customers, the health centers, specialty clinics, small practices, large sort of institutions. We've had these like really forward-looking healthcare institutions come to us many times that's saying, "Hey, we know this is coming, and so we wanna explore something here." And that's actually quite unique. I was very pleasantly surprised by that. And I think there will be other companies and institutions and organizations that will come, but the ones that are like ahead of the curve, they've already started some experimentation here. We have been live. We've been calling. We've made thousands of calls already. We've booked hundreds of appointments. We've found additional revenue for these organizations. We've improved their QI metrics and care closures. We've scheduled appointments. We've done a bunch of interesting stuff already. What we're trying to go for now is, I think, continue to find a select few more partners.
Hmm.
And we're going to develop, and by the way, we're collecting firsthand data that we are aiming to hopefully make available and publish at some point. And we're working with some organizations to do those studies as well. But our hope from here is we're actually going to work with a few organizations and implement this and observe this for a few months. And then when we actually come back, we want to share all the things we've seen. The results we're seeing right now are phenomenal. They're actually quite amazing. So this is really we're really onto something here. But I think that's what we will likely need to see, that other organizations would want to see, that even patients will want to see, that, hey, they've done the work to actually know that this technology isn't creating a problem, right? It is actually for the first time really solving something, and then it's worth adding to this ecosystem of healthcare. It is a net positive to overall healthcare ecosystem. And that's a mission for us. We definitely do not want to create just another tool that is just going to create more problems. We've heard it, we've experienced it, and we certainly don't want to perpetuate that direction of healthcare.
Yeah, I completely agree with you. I think for like the future of healthcare is like AI agents coming and replacing every repetitive task that does not require a physician's brain or a nurse's brain, and you can do that easily with the current technology and what's available right now. So I
Yeah.
completely agree with you. I want to shift gears a bit about talking about Y Combinator. Your company or your startup went through Y Combinator, and lots of people when they hear about Y Combinator only hear about like the tech stuff. Not lots of people don't know even that Y Combinator, they have their own page for what are the things they're looking for when it comes to
Yeah.
healthcare startups. So, how your journey has been through Y Combinator, or what do you think Y Combinator helped Helpcare AI in the growth and the strategy, in guidance, and all these things?
Yeah, so we were part of the first ever fall batch. So Y Combinator switched from 2 batches a year, two
Hmm.
sort of big batches a year, to 4 batches, smaller batches. And we were one of the first ones in the fall. So we just went through this. Honestly, I think it's interesting looking at it from the outside. You think there's all this hype and, like the tweets flying around, like, oh, Y Combinator is, whatever, it's past its prime and all that kind of stuff. And I don't know, going through it, I can see that even some of the cringe stuff that you see, like, oh, these are the world's best future companies, you kind of believe a little bit of that hype. I think you see it there. And you see that because it's definitely very smart people,
Hmm.
both in the companies that have applied and the partners that they have. But more than that, they've created this culture, the Y Combinator culture of growth, of values of what a company should be. And now each company, it's up to them, right? We can adapt as much of the good values or as much of the not so good values, right? Their hype cycles and other things. But I think what they did for us, they brought all some very successful ex-founders. I mean, we had sort of Brian Chesky from Airbnb. We had even Stripe founders. We have Anthropic founders as some of our speakers. We had all these kind of wonderful, inspiring folks. They even had Sam Altman actually for one of
Oh,
the,
wow.
and so I think on some level, just through matter of osmosis and inspiration, you really constantly keep pushing your thinking forward. And I don't
Hmm.
think there's anything like that in this world that is just so motivating, where you can see some of the best in their fields and then you get motivated by it to become one of the best. So that's probably the biggest thing I think we got out of Y Combinator. The second one, obviously, the partners themselves, they have guided us, they've helped us understand. There's too many distractions for a startup, and they've helped us really hone in and focus. So overall, I think it's truly one of a kind experience. Now we think about AI so much. The model is trained on the data, right? And most of these models are trained on the public LLM, like public internet data and all these other things. And then now some companies are building their own models, and they write articles on like, oh, they have some proprietary data they can use. Y Combinator is an exclusive set of proprietary data, is what I'm going to say, that you can train yourself on, right? Like it is just
I
hard
completely
to
love this.
it's hard to
Yeah.
mimic. So if you were if you were an LLM, you now have access to a set of experiences that maybe rarely anyone else has access to, and what you do with it is honestly up to you. But yeah, truly, well, it's been a great experience for us.
I love it. I completely agree with you. I think you learn by osmosis, and you touched upon on the culture that they emphasize building the right culture of the company, which is one of the most important things. Like that, the culture is what helps company go through the hard times. Um,
Yeah.
yeah, and talking about the hard times, I think one of the biggest hurdles in healthcare is finding your first customer and building the product and making it HIPAA compliant. Can you tell me a bit about the challenges you had in each one of those phases? Um, let's say you had the idea today. Take me through from the time you had the idea until you build up your MVP. I'm sure like you went through lots of difficulties. It's not easy to build a product in healthcare. Can you take
Yeah.
me through those difficulties and how were you able to solve them?
Yeah, we've been iterating really, really fast thanks to all this modern technology. I mean, like I said, I've been in AI for 14 years and I felt this is the time. Like it used to be so long to see anything in AI, but like now you can do a turnaround in days, right? Because
Yeah.
just the tools are phenomenal. It's just brimming with potential. So we tried a few different things. Um, we tried the ability to be a receptionist as someone who's taking in on the calls. We
Hmm.
experimented that with a practice. We had our own version of this UI use of computer use stuff a few months back before some of the before Anthropic came out with their version 2. So we created some of this really core technology. We had some languages that we've tried. Um, and we attempted a bunch of different use cases, both from the practice side and the patient side. And I think what really kind of helped us understand, probably the biggest learning is it's not enough to just do what people were doing and then have the AI do it, right? It's not just enough to agentize something. Yes, there might be cost savings and stuff, sure, but that's not enough. That's not the bar. The bar is that when the AI does the same thing, it has to be 10 times better or 100 times better. And what
Hmm.
that means is inbound, I realized there's too many reasons you can call a practice. There's like lots of context in there, and then maybe not so great where the LLMs aren't or the agents aren't so great at that. But outbound, where we're calling patients, that's actually a much more confined context window. And you're talking to them about a very specific reason. You're trying to book an appointment for a very specific thing. But you can load that agent with a lot more context, and they can just not just call like, "Hey, I'm just calling, to book an appointment." No, they can be very personable. They know your history. If you ask them a question, they can answer that. Well, for you, actually, it's because you have this kind of lab values from your last time, or you have this condition, and here are the guidelines for that, and any other questions that they have. And then if they want to speak in Spanish or Mandarin or Arabic or any other language, the AI can continue talking. So that I think probably is the biggest learning we realized, and some challenges in picking the right use cases that we came across. So it was
Hmm.
months of sort of iterating in this direction.
Yeah.
What we were lucky with was because having worked somewhere in healthcare before, and when we do talk to practices and health centers, they didn't see us as just a tech company, because I don't think just a tech company can solve this, you need to be a health tech company. You need to have really good healthcare, deep healthcare knowledge to be able to find the right things. So we were lucky enough to get some of these partners early on that kind of worked with us. They are helping figure out what the use cases are. We're helping them figure out what is best for AI and what isn't. And together, we're sort of building an experience of how AI can work in healthcare with patients that doesn't disrupt each one of these things. And the last thing for security, I think hallucination and HIPAA compliance and all those things are definitely factors. But that was actually, I think our first few months was just figuring that out. We
Yeah.
spent a long time making sure everything is HIPAA compliant and there are no hallucinations going on. And we have some very robust systems built for that. And so I think we've done so many calls and we've had any of these issues and we've tested them at 10 times that, and we're very interesting tests going. We build agents that talk to our agents and they're like argue with them. So our AI is arguing with our AI and we're seeing how our AI handles it. You can create lots of really interesting things to make it robust. Yeah, no, these are important, valuable things. And only a health tech company in my mind can do this. Like OpenAI is not HIPAA compliant out of the gate, right? ChatGPT is not HIPAA compliant, right?
Yeah.
You have to do all of that stuff. But even when you do just get HIPAA compliance, the context and the security and the temperament of healthcare as a whole, that also needs to be built into the AI, regardless of the use case. And that's the space that we're really focusing on. Yeah.
I think also like one of the things that help you in finding the customers, this is like from outsider perspective, it's the problem that you are solving. It's real and it's very simple.
Yeah.
It's real. It's simple. It's out there. If I'm a healthcare organization, I have 10 people who are making phone calls, and I can make them like 100 with the use of AI. Why not?
Why not? As a matter of fact, what's interesting is we were working with a health center, and they had these outreach lists for patients that need to come in for an appointment. They just never gone through the whole thing because
Yeah.
there's so much influx of patients. There's not enough time. Yes, the MAs and the nurses are trying, and even your front desk staff is trying to make these calls, but you're constantly getting distracted by other things. And
Oh
so can
yeah.
you imagine just like never done that? Our AI does 100 calls a minute.
Yeah.
We're just done in a day. And
It's crazy.
that's when you realize, oh, it's not just the first call. You may not get them on the first call. 70% of calls go to voicemail, especially during office hours. So you
Oh
need
yeah.
to
You have
reach
to call them several times.
you have to call them in the evening. You have to call them in the weekends. And those things are not possible. Are you going to hire people for 24/7? Are you going to hire them for the weekend? Absolutely not, right?
Yeah.
And
Yeah.
so, yeah, that's where that whole 10x comes in. And we think this is a phenomenal use case. Like just getting the administrative part of find, call, and schedule. That's sort of how we're thinking about it. Just getting that done is 30% boost for any practice, 30%, 2 to 3 times boost for quality. And we haven't even touched some of the more complicated stuff.
I love it. What advice would you give someone who's going to healthcare or trying to build in this space? And what advice would you give someone who's trying to go through Y Combinator as well and be part of their healthcare startups?
Yeah. For healthcare, my advice would be don't fall into the trap of tech startups where you're trying to grow really fast and create a really big hype. Um, when you do that, you don't have enough time to go deep and thoughtful.
Yeah,
And be prepared for the second route. Like, be prepared for the deep and thoughtful. Be prepared for maybe taking a little bit of extra time, even with the customers taking a little bit of extra time. No, this is not a light decision that anybody makes, both in the product that you build, the user experience you create, the patient experience, and the experience for the customers. So that would be my advice: is healthcare is a thoughtful, slow, and deep building industry. If you want to go in there, be prepared for that. If you're looking for quick wins, go somewhere else, right? Um,
I completely agree.
and, yeah, and that we definitely are pacing ourselves. We think what we have, what we see, and what we're showing is just a fraction of what's possible right now. And the second thing for Y Combinator, you gotta try multiple times. But good thing about Y Combinator, I haven't seen such a transparent thing before. It's everything they ask for in the application. It's so well thought. Every question, every little thing is just so well thought out. Um, the Y Combinator interview is 10 minutes. And you would think like, oh, how can they decide in 10 minutes? It's just that because they know instinctively whether you're on the right track or not, whether you have the combination of things that you need. So really just look at the application, fill it with the best way that you can. Think about each question a little bit deeply. They're very well worded, in my opinion. And then they have the startup school videos that explain exactly how they think about a company. Like, what type of problem should you be picking? What is it? What are some signals of a bad problem? What are some signals of a good problem? What are some signals of you really seeing customers or like feedback from outside that they like your thing, or you just believing the hype, right? What is the signal that you're distracting yourself with something that's cool, or you're building something that's important? And those are like they have all the beautiful videos on this. And honestly, anyone can just look at those questions, look at those videos, look at their business, and reframe it with those learnings. Do it a few times. I can't imagine you won't get in. But even if you don't get in, that is what I think made healthcare the process of applying to Y Combinator allowed us to become sort of solid on our idea. Whether we got in or not was beside the point, actually. We were even not thinking about that at some point. We was surprised that we even got in. We were thinking we're just gonna continue. We had customers and directions lined up just from their videos and questions and how it helped to shape our thinking. So yeah, that's my advice. It's all out there. It's not too hard, and you should apply. Do not be afraid, and do not think you're, whatever. Maybe it's healthcare, they won't take it, or it's not an explosion business. Absolutely not.
Yeah.
The world is completely changing now. You talked about their demands of what they're asking for now. It's completely different, right? So
Yeah.
they're
Yeah.
like,
Yeah.
yeah, space, healthcare, manufacturing, all the things you didn't think. So not just SaaS.
Exactly. Exactly. And they are specific when it comes to healthcare. Like they are asking for specific things, which I completely agree with them. One of the things is like MRI technologies to screen or cancer screening tools. That's another topic. But also, I want to like emphasize one point you mentioned that I think is very important in healthcare is like build what is important, not what is cool. And
Yeah.
these are two important things. And you have to be an insider in healthcare to know what is cool and what is important. Those are two different things. You might be
Yep.
able, for example, yesterday I was talking to one of the startup founders, like they were trying to create this marker that measures inflammation. It is cool, but it's not helpful because physicians can't act on that. They will tell you lose weight and exercise, which we always do. But anyways, that's another topic. I don't want to take more of your time on today. Thank you so much for being here today. I really appreciate your time and thank you so much for being here.
Yeah, thank you for inviting me. Thank you for the thoughtful questions. And I'm really happy with what you're doing. I'm gonna seen some of your videos. I'm gonna see some more, and this has been phenomenal. Thank you.
Thank you so much.